So my name is Marjorie Johnson, and I'm going to go ahead and perform an initial history taking. I'm going to ask you a few questions, just some past medical history, and your own personal medical history as well as your family's. Okay. Um, so go ahead and tell me how old are you?
30.
Okay. And what's your date of birth?
May 2nd, 1988.
Okay. And what race do you identify yourself with?
Black.
Okay. And then, in short, do you have any complaints today? Do you have any chief complaints? Like, are you having any symptoms of any kind?
No.
You're not?
Mm-mm.
Okay. Okay. Can you tell me a bit about your general health? Do you have any chronic illnesses?
No.
Okay. Do you have any psychiatric diagnoses? Like, do you have a history of like schizophrenia or bipolar or depression or anything like that?
No.
Okay. Do you have any infectious diseases?
Mm-mm.
Have you ever had infectious disease?
Mm-mm.
Okay. Do you have any medication allergies?
No.
Okay. Have you ever had any surgeries?
No.
No? Okay. Um, have you ever had any injuries or any previous hospitalizations?
No.
Okay. Are you up to date as far as your immunizations?
Yes.
Okay. Um, can you tell me a bit, and I have to ask everyone this, about your sexual history? Are you monogamous? Do you have multiple sex partners?
I'm married.
You, okay.
I'm monogamous.
Okay. Do you have past history of sexually transmitted diseases?
No.
Okay. What about, can you tell me some information about your grandparents? Do you know, are they're living or not living?
Deceased.
Okay. Do you have any information in regards to how they passed? Like, did they have a chronic illness?
I don't know.
You're not sure?
Mm-mm.
Okay. Do you have a family history of any, like, eye conditions, neck conditions, throat conditions?
No.
Do you have a family history of cardiovascular disease?
My mom.
Okay, your mom. And do you know exactly what kind of cardiovascular conditions she had?
Heart failure.
Heart failure?
Yeah, congestive heart failure.
Okay. Do you have a family history of any neurological conditions?
No.
Okay. Any pulmonary history, like pneumonia or COPD or chronic lung problems?
Mm-mm.
Okay. Do you have a family history of any gastrointestinal issues like stomach problems, GERD, like acid reflux or anything like that?
Nope.
Okay. Any history of any genital urinary issues like bladder problems or prostate problems or anything like that? Prostate
Nope.
cancer? Okay. Any musculoskeletal history in your family? History of musculoskeletal conditions?
Cerebral palsy, maybe? Is that one?
Okay, I'm going to write this down as part of your history.
My uncle.
Your uncle had cerebral palsy?
Mm-hmm.
Okay. Any history of obesity in your family? Like, overweight?
I don't know. I don't know.
mom, dad, siblings?
I guess yes.
Okay, so who specifically in your family is obese?
I guess my mom was obese.
Okay,
And my sister is obese.
okay. Do you have cancer in your family?
No.
Any history of bleeding disorders?
No.
Any mental or emotional issues?
No.
What about genetic disorders?
No.
Any history of substance abuse, like alcohol,
No.
use, drugs, or anything like that in your family? Okay. Do you have any allergies in your family? Like, is anybody allergic to any medications or foods or anything like that?
No.
Okay. Can you tell me your place of birth?
Alexandria, Louisiana.
And can you tell me your nationality or ethnicity?
What, is that black again?
Like African American?
African American? Yeah.
You said your marital status, you're married, right?
Yep.
What is your occupation?
Military.
Okay, and you are military. Ask for military history. And who do you live with?
My wife.
Okay. And then how would you describe your habits as far as like your diet, your hydration, your exercise habits?
Well, I exercise 3 to 4 times a week, if not 4 to 5. And I drink probably a gallon of water a day.
Oh, that's good.
And what was the other thing?
As far as your diet.
I think I have a pretty good diet.
Okay, what does your diet mostly consist of?
Like carbs, protein, stuff like that.
Yeah.
I don't eat as many vegetables as I should, but I do eat vegetables. My wife makes me. I eat the right amount of protein and carbs a day, and I don't have a lot of fats in my diet. I don't eat a lot of candy or any of that stuff.
Okay, good. All right. What about tobacco use? Do you smoke cigarettes or chew tobacco?
No.
Okay. Do you drink alcohol?
Yes.
Oh, you saw me once a week, right? Or 3 times a week?
Once a week,
Once.
if that.
What about drug use?
No drugs. I'm in the military.
Okay, well, let's do that. You don't do drugs. Do you feel like you get enough sleep?
Yes.
Okay, on average, how many hours of sleep do you get at night?
8.
Okay, and then how are your stress levels and like your emotional
I have
state?
the normal stressors, which are good stressors at times. That's about it.
Okay, and then do you have any alternative healthcare practices? Like, do you take natural supplements or drink herbal teas
Nope.
or do natural things?
No. I take men's vitamins.
Okay, anything else?
No.
Okay. Do you have concerns with violence or safety
No.
in your household or
No.
no? Okay. Okay, how would you describe your overall health?
I think my health is great. My
Okay.
voice hurts sometimes because of my job.
Oh, okay.
It
Have you
hurts-
tried any
it
like
hurts right
soothing
now.
teas? They have like
Yes.
throat
My wife
soothing teas.
makes me drink them, and it helps me a lot.
Okay. How about your eyes? Do you have any
My eyes are terrible.
blurred vision?
Yes, I can't see like 15 feet in front of me.
So do you have
Just
blurred
reading.
vision and
Yes. So just reading. I just can't read anything small, like 10 to 15 feet in front of me.
okay. When was your last eye exam?
Probably 2016. Yes,
So 2 years ago?
2 years ago.
Okay, have you had any difficulty with hearing, any ear pain?
No,
Any runny nose or sore throat?
no,
Any problem swallowing?
no,
Any sores or lesions in your mouth?
no.
When was your last dental exam?
It was actually last week, Monday.
Okay, and how'd that turn out?
No cancer. Said my teeth were good. I have to go back on the 27th for a cleaning.
Okay. So
They
you
said I
stay-
have great teeth.
So you stay on top of your dental stuff?
Yes.
Good. Okay, good. Okay. So, have you had any like chest pains recently? Any abnormal heartbeats?
No,
Shortness of breath?
no,
Any coughing? Difficulty breathing?
no.
Okay. Do you have, how many bowel movements do you have on a daily?
2, maybe 3, but 2 on the normal.
Okay. Do you have any diarrhea or constipation or like blood in your stool?
No,
Okay. Do you have any difficulty with urination?
no,
Do you have any painful joints or muscles or problems with your range of motion?
no,
Okay. Do you have any like changes in your skin or dryness or rashes or lesions?
no,
Okay. Any dizziness, unsteady gait, unilateral weakness,
no,
any seizures?
no,
Okay. Any issues with depression, anxiety,
no,
bipolar? No.
no,
What about, do you get hot or cold really easily?
no,
Have you had a recent, like, substantial amount of weight loss or weight gain?
no,
Do you bruise easily or have prolonged bleeding
no,
or take a long time to heal?
nope,
Are you allergic to any foods or environmental substances?
no.
Okay. So I'm going to be performing the initial physical assessment. As far as the general survey is concerned, my patient looks like he's in a very good state of health. He has no issues with his breathing. I checked his posture originally, and he had very good posture. He has very good hygiene, no odors, very good smell. His mobility is very good as well. He's very attentive, and his attitude is very positive, and he's very expressive. He hasn't had any, I haven't been concerned as far as his orientation. He's been alert oriented ×4, and he doesn't seem like he's in distress or has any present illnesses. For this consideration in this physical assessment, I went ahead and grabbed his weight and his height ahead of time. He is 5'9", and he is 195 pounds. I took his blood pressure, which was 130/65. Heart rate was 76. Respirations were 16. And temperature was 98.5. So now I'm going to go ahead and assess his visual acuity. So, sir, what I'm going to have you do is I'm going to have you hold this card and just put it right in front of your left eye. And I'm going to assess his visual acuity.
Do I close it?
Yes.
Okay.
And this way, I'm going to go ahead and put my fingers back here, and then, well, actually over here. And then you tell me what number you see.
2. 2. I can't see it.
Okay.
1. 1. 1. 1. My nose is in the way. 1.
Okay, and go ahead and cover your other eye. And we're gonna do the same thing. So tell me how many numbers you see up here.
3, 3, 3, 3, 3.
Okay, very good. Okay, so now I'm going to go ahead and inspect the skin for moisture, dryness. For my patient's privacy, we're going to go ahead and keep his sweater on. Okay. I'm assessing for rashes, any facial swelling, which he doesn't have, any asymmetry, any cyanosis, but he doesn't have any of that. I'm going to go ahead and inspect the skin, the hair, the nails for appearance, turgor, mobility, his temperature. I'm going to check for edema. I'm going to also check for any clubbing, any issues with pigmentation. I'm going to be checking his hair distribution and checking him also for any joint swelling. I'm going to inspect also for any scars, any vascular and purpuric lesions. I'm going to inspect his skin for any suspicious tumors and nevi. If I do find nevi, I'm going to go ahead and do an ABCDE method for evaluation of his nevi. So I'm going to go ahead and inspect the head and neck, inspect his face and his neck for facial expression. For symmetry, I'm going to check for any edema. I'm going to palpate the head for shape, appearance, his hair and scalp, texture. I'm going to also be checking for any hair loss or any lesions. I'm going to go ahead and palpate the temporal artery, TMJ, his frontal and his maxillary sinuses. I'm going to go ahead and assess his cranial nerve 5 for motor and sensory function. So I'm going to go ahead and take this Q-tip and tell me when you feel. Open your eye. Just tell me when you feel this. Okay. And I'm going to do it on the other side. Go ahead and tell me if you feel that.
Feel it?
Okay. So that's normal. I'm going to go ahead and also assess his cranial 7 function. So I'm just going to have you go ahead and smile for me. Give me a big smile. Okay, so perfect symmetry, so no signs of asymmetry or signs of stroke, no droopiness. I'm going to go ahead and inspect his eyelids. I'm going to be checking his sclera. Open your eyes for me. Checking his conjunctiva, his cornea, his iris, his lens, and his pupils. I'm going to be assessing for perla, essentially with my pen light. So we can pretend this is my pen light. So I'd be assessing for perla. So his eyes are actually pearl, they're equal reactive. I'm going to be assessing also for extraocular movement. So I'm going to have you go ahead and follow this light for me. So currently I'm assessing the cardinal gazes. So he does not have any nystagmus. I'm gonna go ahead and do my ophthalmoscopic exam. I'm gonna check for the red reflex, his vessels, his retina, his optic disc. I would actually have to have the light off for this, but because of the camera recording, it's not going to be able to capture what I'm doing, so I'm just going to go ahead and leave the light on. But essentially, I would have to turn the light off, and I'm going to be assessing for the red reflex in that way. And I'm going to be assessing the macula and the fovea as well. I'm going to go ahead and also inspect his ears. So I'm going to complete an external exam of his ears. I'm going to be checking for tenderness, for appearance, and his ears are normal, no tenderness, no pain. Okay, so I'm going to go ahead and assess the ear canal for obstruction. I'm going to go ahead and inspect the other ear as well. I'm going to be performing the whisper test, the Rhine test, and the Weber test. So go ahead and I'm going to turn around and just tell me what you hear, okay? I'm going to whisper.
4.
Okay, I'm going to stand over here and do the same thing.
3.
Okay.
2.
Okay, so he passed that test with flying colors. I'm going to go ahead and do the Rhine test. Tell me when you stop hearing.
No.
Okay, I'm going to do the same thing on the other side.
No.
Okay, and then I'm going to put the tuning fork here for the Weber exam on top of your forehead, and then you tell me where you hear the sound loudest, or if you hear even.
I hear it's even on both sides.
Okay, so he passed that. I'm going to go ahead and examine the inside of your ears. I'm going to inspect your ear canal. I'm going to inspect your tympanic membrane for appearance and normal structure, for color and the cone of light. So this is a normal ear, normal tympanic membrane. I'm going to do the same on the other side. I'm going to be inspecting for tympanic membrane and color and cone. So that's perfect. So I'm going to go ahead now and inspect the external appearance of the nose. I'm going to test for patency. So they're both equally patent. I'm going to inspect the nasal mucosa for appearance and drainage. I'm going to go ahead and assess cranial nerve function 1. So I'm actually going to ask you to identify certain odors. So give me 1 second. Okay, so can you tell me can you smell this and tell me what's in this bowl?
Coffee.
Okay, perfect. Close your eyes. Go ahead and tell me what's in this bowl.
Cheese.
Okay, great. So your cranial nerve function 1 is intact.
It smells like poop. It smells like strong cheese.
Okay. I'm going to inspect the patient's lips, teeth, and gums. Open your mouth for me. I'm going to assess his tongue, his buccal mucosa, his soft and hard palate, his anterior and posterior pillars. Open your mouth for me. I'm going to check put your tongue out, stick your tongue out. Inspect his tonsils, make sure that there's no erythema back there, no pus sockets or any abnormalities. I'm gonna go ahead and assess your 9th, 10th, and 12th cranial nerves. Go ahead and say ah. Okay. At this time, I'm gonna be putting an object that let's make believe this is a tongue depressor. I'm gonna go ahead and put this in your mouth and assess for a gag reflex, which is present. Go ahead and extend your tongue outward for me. There's no atrophy, no weakness in the tongue. And then go ahead and do me a favor and push up against my shoulders here. Okay, I'm going to put my hand here. Go ahead and try to push against turn your head to that way. And then push against my hand. Try to keep me from turning your head. Okay, turn your head the other way and try to keep me from moving your head. Okay, perfect. All right, so I'm going to go ahead and assess now the patient's neck. I'm going to palpate the lymph nodes, the periauricular, the posterior auricular, occipital, the tonsillar, submandibular, the superficial cervical, posterior cervical, supraclavicular, lymph nodes. I'm going to inspect and palpate here for any tracheal deviation. I'm going to examine the thyroid. And actually I'm going to assess, the cranial nerve 11 here. So this is where you would flex, go ahead and flex your shoulders, push against, then turn your head, push against, and do the same on the other side. Go ahead and push against. Okay. I'm going to go ahead and observe for any jugular vein distension, which my patient does not have. Alright, now I'm going to go ahead and inspect the skin for appearance, any lesions, rashes, moles, deformities. I'm going to inspect here the symmetry of the thorax. I'm going to be assessing the respiratory rate, effort rhythm. I'm going to be assessing the patient for any abnormal breath sounds. I'm going to go ahead and inspect the AP diameter. I'm going to palpate the sternum for any tenderness. I'm going to test the patient's skin turgor. And I'm going to go ahead and auscultate the lung sounds. Grab my stethoscope here. So I'm going to go ahead and inspect the patient's lung sounds. So here the right upper quadrant, anterior, left upper quadrant, the left the lower lobe, the right lower lobe, right middle lobe, center lobe here. Okay, I'm going to assess breath sounds posteriorly, so I'm going to assess here the posterior right upper lobe, middle lobe, lower lobe. I'm going to do the same on the other side, the right lower lobe, right middle lobe, posterior right upper lobe. Patient's lung sounds are clear. I'm going to also be assessing for, I'm going to palpate the patient's back and spine for pain, tenderness, and other abnormalities. I'm going to assess for respiratory expansion and excursion, so that's symmetrical. I'm going to go ahead and palpate for tactile fremitus. I'm going to percuss the thorax. I'm going to auscultate the lung fields one more time. So I'm going to palpate the chest here for any pain, assessing for any tenderness or abnormalities. I'm assessing for chest expansion. I just auscultated the anterior chest. So I'm also inspecting here the patient for any heaves and lifts. Okay, so now I'm going to go ahead and palpate for heaves and thrills. I'm going to palpate the apical pulse. I'm going to assess the patient's carotid arteries, the palpation, and I'm going to go ahead and listen to the patient's carotid arteries as well. No abnormalities, no bruits. I'm going to go ahead and auscultate the heart sounds. Okay, so I'm going to go ahead and observe and auscultate the heart sounds. So we're going to first do this sitting down. I'm going to auscultate his aortic, his second intercostal space, which is the pulmonic, the Erb's point, which is the third intercostal space, the tricuspid, and the mitral, which is the fifth intercostal space. And I am assessing for normal sounds. I'm making sure that he doesn't have any S3 or S4 sounds. And we're doing this sitting down. We would do this lying down next, but my patient does not want to be laid down. So for essentially we want to auscultate the heart sounds with both the diaphragm, so we do with the diaphragm and with the bell as well. And I'm going to be assessing here, auscultating, making sure I don't have any abnormal sounds, any S3 or S4 sounds. Okay, I'm going to go ahead now and I'm going to inspect the patient for skin turgor. I'm going to assess the abdomen and make sure that it's symmetric. For my patient's privacy, we're going to go ahead and maintain his sweater on, but I'm checking to make sure sure that it's contour, that there's no visible abnormalities. I'm going to go ahead and auscultate his vowel sounds. So I'm going to auscultate his right upper quadrant, his left upper quadrant, his left lower quadrant, his right lower quadrant. I'm going to go ahead and auscultate his renal arteries. I'm going to auscultate his iliac arteries and make sure there's no bruits. I'm going to auscultate his femoral arteries, both right and left, make sure there's no bruit. I'm going to go ahead and percuss all of his quadrants here, all four quadrants. All his four quadrants are tympanic. I'm going to percuss also for CVA tenderness, percuss for spleen and left upper quadrant here. It's tympanic. I'm going to percuss also and palpate all of his quadrants and make sure that there's no tenderness, no guarding, no distension. I'm going to go ahead and do a little bit deeper palpation here. I'm going to be palpating the liver and the right upper quadrant, the spleen. I'm going to palpate here the kidneys on both sides. I'm going to be assessing for CVA tenderness. I'm going to be palpating here for aortic pulsation and pulsatile mass. I'm going to also be assessing the inguinal lymph nodes. So I'm actually going to have my patient turn around. I'm going to inspect, I'm going to do an examination of the spine. So I'm going to inspect for turgor, appearance, color, temperature, make sure it's not warm to touch. Make sure the patient doesn't have any edema down the spine, any lesions or any inflammation. I'm going to palpate for pain and tenderness. I'm also going to assess for scoliosis or kyphosis. I'm going to assess, you can turn back around. I'm going to assess the range of motion of a few things. Of the cervical, so I'm going to actually have you bend your head forward as far as you possibly can, and then I'm going to have you extend your head backwards. I'm going to have you bring your head back to normal and go ahead and extend your head to all the way to one side and then all the way to the other side. And then we're going to assess your range of motion of your thoracic and your lumbar. So I'm actually going to have you stand, or you can stand right there. And I'm going to have you bend forward as far as possible, and then touch your knees. Touch your knees and touch your toes if you can. And then I'm going to have you extend, come back up. And extend back as far as you possibly can. So he has a normal range of motion. You can have a seat. I'm going to inspect the patient's shoulders, elbows, wrists, hands. I'm going to palpate for any pain and tenderness in the shoulders. in the elbows, in the wrists, in the hands. Do you have any pain anywhere?
No.
No. Okay, so we're gonna go ahead and do a range of motion test and also a strength test. So I'm gonna have you raise your shoulders with your arms overhead for me. Go ahead and extend them towards the back. Okay, good. I'm gonna have you cross each arm in front of your body. Okay, and that's an expected range of motion. I'm gonna have you do curls here with your arms, and then turn your palms up and then down. Okay, good job. I'm gonna have you go ahead and turn your neck and meet resistance with my hand here. Okay, do the same here. Go ahead and push up against my hands here with your shoulders. Okay, go ahead and I'm gonna pull your elbows, you pull back. Okay, good job. Go ahead and grasp my hands tight for me. Okay, pretty strong there. I'm gonna go ahead and assess your hips strength. Go ahead and lean back for me. So I'm gonna have you push your knees up against my hands here, and do the same here with your. Okay, go ahead and bring your knees upward towards the ceiling. Okay, and then go ahead and straighten them out. And we're going to do a range of motion test with your ankles. Go ahead and rotate your feet outwards, and then in, and then point them up, and then down. Okay, good job. Okay, I'm going to go ahead and assess your deep tendon reflexes now. So we're going to use this little device here. So I'm going to do your bicep deep tendon reflex. Just relax your arm for me. Okay, there goes one. There goes two. We're going to do your brachioradialis. Sorry. You okay? Okay. And then we're going to do the other one. And now we're going to do your tricep deep tendon reflex. And now we're going to do your other side here. Okay. That goes that. I'm also going to do a sharp versus dull test. So we're going to do it here on your arm.
Soft, sharp, soft, sharp.
So we're going to do it on your legs.
Soft, sharp, soft, sharp.
And on your feet.
Soft, sharp, soft, sharp.
Okay. We're now going to also we're going to palpate your radial pulses here. And I'm going to be testing for your capillary refill. And that's also normal when you had normal deep tendon reflexes. We're going to assess your popliteal dorsalis pedis. We're going to assess your posterior and tibial pulses also. We're going to assess your deep tendon reflexes as well as your patellar and your Achilles tendon. Okay, go ahead and relax your legs for me. So we're going to do your patellar. And then we're going to do your Achilles tendon. Okay, great. Okay, and now finally, we're going to assess patient's gait, coordination, and balance. So go ahead and walk all the way to the door. His balance is steady and even, coordinated. Go ahead and turn around and walk towards me. Coordination, balance, everything is normal and even. And that finalizes our head to toe final assessment.